This is Sydney Haynes' clinical swallow eval video. So first, I would interview nursing and gather any information about the status of my patient and any other relevant information such as their orientation and cognition. I will then chart review my patient to see when they were admitted, what their deficits are, why they were admitted, etc. So then I would go into my patient interview. Hi Jillian, my name is Sydney and I'll be one of your rehab therapists today. I'm going to start by asking you a few questions about your eating habits. Is that okay?
Yes.
All right. Can you walk me through a typical day of eating for you?
So a typical day, I have 3 meals a day, and I typically don't have any struggle eating. Occasionally I'll have some coughing during meals, but that's pretty much it.
All right. How do you feel about your eating habits? Do you think you have any difficulties eating or swallowing?
I don't have any difficulties.
Okay. What are some of your favorite foods you eat often? Do you eat a lot of bread and meat, or do you eat more liquids?
Do eat a lot of breads and meats. Yeah, those are things I would eat daily.
All right. What are some symptoms you experience with eating? You said your frequent coughing.
Yes, occasional coughing during meals, but not too much to be too concerned.
And you said you eat a lot of breads, so do you feel like food ever gets stuck when you're eating?
Occasionally when eating bread, but not enough to raise concerns.
And are there any foods you avoid eating?
I wouldn't say so.
Okay, next I will go into an oral mech exam. So I'm going to just observe your oral cavity closed and then open.
Yeah.
Then I'm going to have you open and close your jaw against resistance. So I'm going to put my fist and then open your jaw and don't let me close. All right. And then I will do jaw lateralization. So I'm going to push your jaw to the side and push it back towards midline. And other thing on the other side, push it other way. So push your jaw,
Yeah.
and then push towards, okay.
There we go.
Now I'm going to have you puff your cheeks and hold your air and don't let me push them in. All right. Can you wrinkle your brow for me? Good. Can you smile? All right. And then protrude your lips against resistance. So, yep. Good. And then maintain your lips. Don't let me open them. And then can you say ah?
Ah.
Good. And then can you give me a good strong cough? All right. And then can you stick out your tongue? And then can you move it side to side? Let's stick it out. Okay. And then lastly, move it up and back. Okay. Those were all testing cranial nerves and the oral mech. We tested cranial nerves 5 with the open and closed jaw against resistance and jaw lateralization. We tested cranial nerve 7 by puffing out the cheeks and holding air against resistance, as well as wrinkling the brow and smiling. We tested cranial nerve 9 and 10 when we said ah, and then also for the volitional cough with vocal fold closure. And we tested cranial nerve 12 with the tongue protrusion, lateralization, and moving tongue up and back. And lastly, I'm going to test cranial nerve 11 with the shoulder shrug. So I'll have you shrug your shoulders against resistance and don't let me push them down. Okay. Good. All right. And then I'll have you stick out your tongue one more time and keep it out there. Looking for any fasciculations of the tongue. All right. And then I'm also observing everything about the patient, including their mental status, cognition, and their receptive and expressive language through their ability to follow commands during the oral mech assessment. So now I'll go into a dry swallow with cervical auscultation. So I'll just pretend I'll place my stethoscope at the level of the thyroid cartilage and have the patient swallow. noting laryngeal elevation, and also for vocal quality prior to introducing liquids. So then you introduce liquids through a spoon or straw. If the patient's able, they can do it themselves. And then you do cervical auscultation again at the level of the thyroid to note any wet or gurgly vocal quality. And then you introduce thick liquids through a spoon or straw. And you're looking at the patient's oral prep, and then also inside their mouth for any oral residue. And then you go into the swallow screening. So for mine, I will do the Yale swallow screening. So I'll fill this out. Our date of assessment. All right. So Jillian, you are able to remain alert for testing? Are you on a modified diet due to pre-existing dysphagia?
I'm not.
Do you have a feeding tube in place?
I do not.
Do you have a head of bed restriction of less than 30 degrees? Do you have a tracheostomy tube?
I don't.
And are you NPO by physician order?
No.
All right, what is your name?
Jillian.
Where are you right now?
In the clinic.
What year is it?
2024.
Can you open your mouth, stick out your tongue, and smile? All right, now close your lips and don't let me open. Stick out your tongue and move it side to side and up and back. Can you pucker your lips and smile once again? Good. Now we'll do the 3-ounce water swallow challenge. So we have 3 ounces of liquid prepared in a cup. I'm gonna have you sit upright between 80 and 90 degrees. And I'm gonna ask you to drink all 3 ounces of water slowly and steadily without stopping. We observed no coughing or choking, and we observed from the side. There were no pauses, so we write that as a pass. Next, I'm going to quickly also palpate for laryngeal elevation. Again, I'll have you swallow, a dry swallow, and feel for laryngeal elevation. Can you do it again? And then we would also palpate the tongue, but we don't have gloves or a tongue depressor.
Okay.
So stick out your tongue and we would palpate from side to side and up and down. We note any signs and symptoms throughout the study, so there were none any past your Yale swallow screening. And your only symptom that you stated earlier was you cough sometimes while eating, which is normal. Next, we will conduct the EAT-10 questionnaire or any other dysphagia questionnaire. So I'll go through this with you. All right. The date is 12/4/24. Your name?
Jillian.
All right. Your height
5'6".
and your weight.
140.
All right. Can you briefly describe your swallowing problem, if any?
I wouldn't say I have any difficulties.
All right. Can you list any swallowing tests you have had, including where, when, and the results?
I haven't had any.
All right. answer to what extent the following scenarios are problematic for you. A 0 is no problem, all the way up to a 4, which is a severe problem. So the first one, my swallowing problem has caused me to lose weight.
0.
My swallowing problem interferes with my ability to go out for meals.
0.
Swallowing liquids takes extra effort.
0.
Swallowing solids takes extra effort.
Maybe 1.
Swallowing pills takes extra effort.
0.
Swallowing is painful.
0.
The pleasure of eating is affected by my swallowing.
Maybe 1.
When I swallow, foods stick in my throat.
1.
I cough when I eat.
1.
Swallowing is stressful.
0.
So overall, you got a score of 4 out of 10 because you answered 0 for 6 of them and 1 for 4 questions. So we can say your dysphagia, or lack thereof, is not really impacting your life. That was just a way for us to understand more about your swallowing patterns and your eating day to day. So now I will explain our findings and recommendations. So you passed your Yale swallow screening. There were no signs and symptoms of aspiration during the thick liquid trials or the thin liquid trials or during the Yale. So I don't think you need any further diagnostic testing. So I think that's the end of our CSE. Thank you for your time.
Thank you.